Yesterday, the U.S. Centers for Disease Control and Prevention (CDC) added 7 more destinations to its Level 4 very high risk category for travel, bringing the total to 74 nations. Per CDC guidance, Americans should now avoid travel to France, Iceland, Aruba, Israel, Thailand, French Polynesia and Eswatini. Those who absolutely must travel should be fully vaccinated, according to the agency. With the Delta variant of the coronavirus wreaking havoc around the world, the CDC has been on a tear in adding to its Do Not Travel list. Last week, the agency named 16 countries to the Very High Risk category, including Greece, Ireland, Malta, St. Barts, St. Martin and the U.S. Virgin Islands. They joined other popular destinations already on the list, like the United Kingdom, Portugal, Spain, the Netherlands and Costa Rica. Destinations that fall into the Very High Risk category have reported more than 500 cases per 100,000 residents in the past 28 days, according to CDC parameters. The ridiculous irony, of course, is that the United States would easily make its own Do Not Travel list. The U.S. is currently recording 42.4 new daily COVID-19 cases per day, per 100,000 people. Meanwhile, Americans are warned not to travel to the United Kingdom, where 39.7 new COVID-19 cases per 100,000 people are popping up daily. It's also noteworthy that the CDC does not keep a domestic do not travel roster. But if the CDC applied its own standard to individual states, nearly 4 out of 5 would currently be flagged as a do not travel destination. Of the 7 countries added yesterday to the CDC's Do Not Travel list, the one with the highest infection rate is French Polynesia, which is currently reporting an average of 122.6 new daily cases of COVID-19 per 100,000 people, according to data from the Brown School of Public Health. Comparatively, Florida and Louisiana are currently tallying 185.9 and 115.8 new daily cases per 100,000 people, respectively. If Florida were a country, it would be the second most infected place on the planet, just behind Guadeloupe. If Louisiana were a country, it would be at No. 4 in the world for new daily COVID-19 infections. The CDC added St. Martin to the Level 4 list last week. The Caribbean island is currently reporting 85.4 new daily cases per 100,000 people, roughly the same as Oklahoma, which is logging 84 new daily cases per 100,000 people. The third country added to the CDC's list yesterday is Aruba, which is reporting 72.8 new daily cases per 100,000 people. In that ballpark, Mississippi and Arkansas are currently adding 79.5 and 75.7 new daily cases per 100,000 people, respectively. Eswatini also made the CDC's Do Not Travel list. The African country formerly known as Swaziland is recording 59.6 new COVID-19 infections per day, on average, per 100,000 people. Comparatively, Alabama and South Carolina are seeing 66.9 and 54.6 new cases per 100,000 people, respectively.